Hello, welcome to ANA community. From the past several videos, we are having the interaction of how to take the case history. Initially, it was started with analysis of chief complaints, which was being followed by analysis of history of present illness. What are the pitfalls or the lacunae done by the students in recording the history of present illness, previous history, treatment history, family history, personal history, social history, environmental history, etc. being dealt. In today's video, we are going to discuss why elaborate case history is important. What is the benefit of looking into that particular elaborate case history that is going to get discussed in this particular video. As we all know that case history is the first and foremost step of 5 steps of diagnosis. Case history, physical examination, the collection of all the data pertaining to the case history, rejection of relevant data and the selection of relevant data and rejection of irrelevant data, and fifth step is suggesting the laboratory investigations. So today we are having the discussion on why this particular case history is important. There are basically 5 main points are there, which are usually considered to be the helpful in noting the significance of the case history. First and foremost thing, it frequently affords a clue to the diagnosis. For example, if a person is suffering from cough with pink Froði sputum, most commonly the person may be having the left ventricular or left atrial dysfunction. If the person is having the cough with the frank blood, etc., then we are going to think of the infections or otherwise some kind of life-threatening conditions of a respiratory system. For example, pulmonary tuberculosis or pulmonary embolism, etc. we are going to think of. Suppose if the person is having heaviness in the frontal region, the most commonest cause will be paranasal sinuses, that too frontal sinus involvement. Reduced strength in the left, the right upper limb and lower limb of the person makes us to move towards the diagnosis of a neurological disease, that too cerebrovascular accident or stroke. If the person is presented with the breathlessness during inspiration, that is indicative of the dysfunction related to the upper respiratory tract, that is from the nose till the larynx. In this way, if you are getting the identifying the symptom itself or noting the symptom is helping us in moving in the particular direction, in channelizing our the viewpoint towards a particular diagnosis of a disease. And it rules out certain diagnostic possibilities also. When you say about it, diarrhea, wherein the person is having the pain in the lower abdomen, it is usually indicative of the person may be having the disturbances related to colon. It is not the urinary bladder. In case of the urinary bladder involvement, the person will be having lower abdominal pain associated with dysuria. This way, it rules out certain diagnostic possibilities also. Let me take one more example. If the person is having running nose and he is having pain in the ear, that is indicative of a nasopharyngeal involvement. This rules out the involvement of the larynx itself. When there is involvement of the larynx, the person will be having the hoarseness of voice. In this way, it rules out certain diagnostic possibilities also. It suggests further avenues of investigation. For example, if the person is having the multiple joint pain, symmetrical joint pain, and with morning stiffness, which is present for more than half an hour in a day, that is usually indicative of the person may be suffering from rheumatoid arthritis, or what we can say, the autoimmune disease as such. In that particular situation, the diagnosis of the disease will be done by rheumatoid arthritis test. Suppose if the person is having joint pain, which is of fleeting nature, in that particular situation, the laboratory investigation performed will be ASLO test, that is anti-streptolysin O test. In this way, it helps us in making the, what do you say, that the what kind of investigation that has to be performed, that can be learned. Suppose if the person is having the presenting complaints of hemiplegia, so that means the loss of strength in left upper limb and lower limb. The ideally, the diagnosis will be done by CT scan head to rule out the probable cause of the disease as either ischemia or hemorrhage. So then, if the person is presented with fever, then ideally we are going into the certain investigations as the complete blood count, to know about the components of the abnormal components of the blood, certain specificities such as peripheral blood smear, to know about the malarial parasite, and viral test to know about the diagnosis of the, what do you say, that the typhoid, etc., that can be made out. To focus observers' attention to the system affected or systems afflicted. In the sense, when the person is presented with chest pain, the most probable causes of chest pain are respiratory disease, cardiac disease, alimentary canal disease, musculoskeletal disease, and neurological disease. So, when the person is presented with chest pain, these are the 5 system dysfunctions the person will be looking into whenever if he is moving towards the diagnosis of a disease. That means it rules out the dermatological illnesses, it rules out the other endocrine dysfunctions, etc., etc. So like that, to focus the observer's attention to the system affected can be made out. And the last point wherein importance of history is considered to be symptoms as such that usually precede the signs. Symptoms means the subjective presentation of the discomfort, whereas signs refers to the objective presenting complaint as such. So that means symptoms are those which are told by the patient, and signs are those which are elicited by the clinicians. Let me take for example, if the person is having the sneezing, it is the presenting complaint, it usually precedes nasal blockage. Or otherwise, if the person is having the numbness, it is usually preceding the, what do you say, that the cerebrovascular accident features, such as the total loss of strength, etc., etc. So, like this, the symptoms usually precede the signs. And when you think about the case history itself, nearly around seizures, that means the convulsions or convulsive episodes, ischemic heart disease, and psychiatric illnesses are solely diagnosed by accurate history itself. So these are the different reasons wherein the the importance of case history lies. That means first important point, it actually the accurate history frequently affords a clue to the diagnosis, which particular area one the clinician has to concentrate. It rules out certain diagnostic possibilities. That means it is helping in the differential diagnosis. Third, suggesting the further avenues of investigation. What kind of investigation a clinician has to order, and to focus the attention of the clinician where the systems are afflicted that can be narrowed down, and symptoms are usually preceded by signs. Symptoms usually precede the signs. So these are the significance of that. Let me give you the one example. So here two images are there. First image, that is showing the person is having the presenting, that is cough. In the sense, what is based on the significance, so we are solely concentrating upon two major clinical conditions. One, that is the respiratory disease and cardiac disease. Of course, certain other aspect that one has to concentrate, that is alimentary canal disease, will be to a lesser extent. Whereas the other image that is mainly concentrating upon the dermatological illness as such. So like that, the take-home message from today's discussion is case history is the first and foremost step of clinical diagnosis, which requires excellent communication skills. That means whenever if you are asking about the presenting complaint, it has to be mentioned in the context of what you say, that the patient's own words. It should be mentioned in the chronological order, and it should be mentioned along with the duration. So this is what is the case history as such. When you think about the further aspects of case history, it has to be in the form of history of present illness, past history, treatment history, family history, personal history, menstrual and obstetric history, social history, environmental history, and occupational history. In this way, you have to note it down. When you are speaking about history of present illness, if the person is not having the pain, in that particular situation, the document should have onset, duration, severity, course of the symptom, aggravating and relieving factors, and the negative history. If the person is having the pain, in that particular situation, history of present illness should include onset, duration, location, radiation, character, severity, course of the symptom, aggravating and relieving factors, and negative history. In that way, so your communication should have the documentation of all these informations. So in total, when you are noting about this, it suggests that each and every step of case history has to be followed methodically to document all the information pertaining to the illness of the individual. And all sections of case history are having their own significance in narrowing the clinical diagnosis. So, the dear ANM members, That's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one topic that you'd like to hear in this particular channel? Mention in the comment box below. And if you are liking this particular video, then put a thumbs up and spread this particular video to maximum number of true Ayurveda learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in next video. Thank you.